If you have lymphedema in the arm, keep watching for an updated and modified manual lymphatic drainage routine based on some newer research that's been found to be effective and what I've seen to be helpful in the clinic. I'm Dr. Alex Hill. I'm a board certified physical therapist specializing in oncology and lymphedema. Make sure that you subscribe for more videos on lymphedema management and check out my free e-guide on cancer-related lymphedema in the description below. If you're familiar with manual lymphatic drainage or MLD in the arm, then you know that traditionally we've moved that fluid away from that affected area to different lymph node beds. But recent and growing research from studies out of the ALERT program have provided some fascinating and positive insights that are already leading to changes in how MLD is performed. So, if you have lymphedema in the arm and you're ready and looking for an updated version of MLD, keep watching this video. But if you want to stick with the traditional, tried and true MLD sequence, or if you have very severe lymphedema, I have the link to that in the description below. So as we go through this sequence and I give you a little bit of background, we're going to pretend that my left arm, the arm with the watch, has lymphedema. So this is my affected area throughout this whole video. And so a little bit of background before we dive into this new MLD sequence. So research findings from the ALERT program, which is linked below, indicate that the lymphatic uptake during MLD in the arm, so again, my left arm, is actually highest in the lymph nodes on the same armpit, followed by the clavicular region, which is here, and then the peristernal region, and then the opposite armpit. Importantly, it seems that there's no or very minimal lymphatic fluid that drains down to the inguinal or groin region on the same side. This is really where the difference lies for this updated MLD sequence. So we are not moving the fluid down the trunk like we traditionally have, and we're focusing our efforts on moving the fluid of the arm into that same side armpit, into the clavicular region, and into the peristernal region. If you have moderate or more severe lymphedema, then you definitely want to continue moving across the arm or across the chest to that opposite armpit. And I'll walk you through that as we go through this new sequence. Now, this research is still relatively new, and the research findings were based on each person's individual lymphatic anatomy in the study using a specialized type of imaging called ICG imaging. Many clinics do not have access to this type of imaging, but we can still use the findings of these studies to help guide adjustments to improve efficiency, especially when time is limited, or for creating an MLD routine that's easier for you to stay consistent with. So some safety things, as always, check with your own certified lymphedema therapist first before changing any part of your lymphedema program. And while you're doing MLD, if you feel shortness of breath, chest pain, heart palpitations, or your heart is fluttering, or something just doesn't feel right, stop immediately and let your medical provider know. All right, so let's get into that new sequence. So regardless of how severe your lymphedema is or how mild it is, the starting point is always the same. You're going to start with your hands on your abdomen at your belly button while you're either lying down or you're sitting in a comfortable supported chair. You're going to breathe in through your nose, pause, and then slowly breathe out through your mouth. As you breathe out, you're going to gently press into your abdomen, and this really helps to stimulate the central part of the lymphatic system. But if you have pain or you're not comfortable doing the abdominal pressure, just simply doing the diaphragmatic deep belly breathing is still helpful. So go ahead and breathe in through the nose. Breathe out as you press in. Go ahead and do that 2 more times. Breathe in, breathe out and press in. And 1 more time. Breathe in and breathe out. So the next part is working on all 4 quadrants of your abdomen. So you can see here my abdomen is split down the middle and then across the middle as well, horizontal. So we're going to start in the left lower part of your abdomen. You're going to be breathing in and press in just like we did at the belly button. So breathe in and breathe out, press in. Move to the right side on the lower part of your abdomen. Breathe in and breathe out. Come to the right upper part of the abdomen, just below the rib cage. We're gonna do the same thing. Breathe in and breathe out. And to the left upper abdomen, breathe in and breathe out. If you have moderate to severe lymphedema, go ahead and do that another 1 or 2 times to really stimulate that central lymphatic system. Now that you've finished the abdomen, we're going to move up to the neck. So you're going to massage directly behind the collarbone. You're not coming up onto the neck or way in the back to your upper traps just yet. You're coming right behind the collarbone. You can either do this with one hand at a time or with both at the same time. And you can also cross your hands so that you're getting both sides at the same time. Regardless of what side you have the swelling on, you're going to stimulate both sides. Make sure you use the pads of your fingers and not the tips. So go ahead, place your fingers right behind the collarbone, and you're going to do 5 to 8 circles going around in the same place. So you're not moving from the position that you're at. You're just doing circles right where your fingers are placed, and it doesn't really matter the direction. After you do 5 to 8 circles just behind the clavicle or that collarbone, then we're going to go up to the lymph nodes that are around our ears and in our neck. So you're going to split your fingers and you're going to have 2 in front of your ear, and then you're going to have 2 behind your ear. And again, we're going to do both sides, and we're doing circles just like we did at the collarbone. So you're going to do those slow circles, again, behind and in front of the ear where we've got lymph nodes. And you're going to do this 5 to 8 times. All of our movements as we do this sequence are going to be slow and moderate pressure. All right, once you've got 5 to 8 done behind and in front of the ears, now we're going to move to the lymph nodes at the armpit. So again, we're saying that if you follow along, my left hand, the one with the watch, is the side that has the swelling. If you have swelling on the right side, then go ahead and you're just going to switch the direction that we're doing this. So we're going to start stimulating the lymph nodes in that affected side in the armpit. So you're going to take your hand, make sure your fingers are close together, place them directly in the armpit. You can place this hand on top of your head, or you can rest it on an armrest or on a table that's next to you. But you're going to place your hand in the armpit, and again, you're doing those 5 to 8 at least circles in the armpit. Because again, this research shows that the majority of the fluid drains to these lymph nodes. If you want to, you can definitely do more than 5 to 8 times. That 5 to 8 times is just a minimum amount to start to get things stimulated. After we work the lymph nodes in the armpit, then we're going to do the other side. So you're going to stimulate the opposite lymph nodes in the opposite armpit. Same thing, you're making sure that you've got full flat pressure against the skin. We're doing that at least 5 to 8 times. And again, you can do both sides regardless of what side you have the lymphedema on. So now that we've stimulated both armpits that have the lymph nodes, now we're going back to that affected side, and you're going to be starting to move this fluid to this armpit. So it's not uncommon for people that have lymphedema in the arm to also have some swelling into the breast, chest, or even into the back or side of the trunk. And so you're going to start and you're just massaging up into the armpit. This is best to do skin on skin, not over your clothes. You're going to get much better tension along the skin to get better movement of that fluid. But again, you're just moving from just below the chest or the breast tissue, and you're moving it up towards the armpit. You can spend, again, at least 5 to 8 times here at this area, bringing that fluid up to the armpit and starting to get that fluid moving and back into the system. So once you finish moving that fluid up to the armpit, that's more on the side of the chest or the breast, then we're going to be starting to move that fluid up to the clavicular region here. So you're going to be moving that fluid up and over. So think of it almost like a rainbow movement. You're keeping flat hand and fingers on the skin, making sure that you're keeping them soft. You don't want really strict, hard fingers. And you're going to give moderate, slow pressure coming up to that clavicle or up to the collarbone. Again, everything we do, slow movements, 5 to 8 times. And you can definitely do that more if you have more swelling in the arm or in the breast or the chest area. And then after you've done that 5 to 8 times, then we're going to be moving that fluid to that parasternal area here in the center. So you're going to be, again, taking fingers together, and you're moving it to the mid part of the chest. So you can see I am above the breast tissue or above the chest tissue. If you have swelling at the breast or at the chest, you can come lower and bring that up and over as well. Just make sure you're getting all areas and you're not leaving any skin untouched. Again, slow movements, 5 to 8 times, and you're bringing that over. As you do this lymphatic massage, make sure you're also doing that deep breathing. And while you're doing this, again, if it feels more comfortable, you can have your arm up on top of your head. You can have it resting or elevating as you do this as well. Now, if you have moderate or severe lymphedema, then it would be beneficial for you to continue moving across the chest as well. So then you can keep continuing that movement coming to that opposite armpit. So you're going to just gently pump across to that opposite armpit, helping to offload some of that fluid. And you can see, even though we are still doing this 5 to 8 times, I'm pumping across. So I'm not just doing one sweep, we're pumping that fluid across. And again, we're doing a moderate pressure, and we're doing that 5 to 8 times. If you have mild lymphedema, then you don't need to do this part where you're pumping it all the way across to the opposite armpit. This is really just if you have a lot of swelling, if you have moderate or severe lymphedema in that arm or in that breast, it's just going to help offload a little bit more of that fluid. So once you've done this 5 to 8 times, then we've now worked that proximal fluid, that more trunk fluid, to the armpit, to that clavicle region, to the parasternal area, and if you need to, the opposite armpit. Now we're gonna start working on that arm. So we'll work on the shoulder first, and you can do circles around, so making sure that you're getting the entire shoulder worked. And if it's hard for you to reach back here, it's okay if you're just getting the front and side. And if you've got someone at home that's able to help you, that's great, but otherwise just do what you're able to reach. And all of our movements are, again, bringing it up and in. After you've done that at least 5 to 8 times, then we're going to start to move down the arm. So again, traditionally it was always moving that fluid out and up, but now we know that we can move it in towards that armpit. So again, you can rest your hand on your head or have it resting on a table or the couch armrest. With that arm up, you're going to start to bring that fluid down to the armpit, and making sure, again, you're keeping fingers together. And what we also know about doing the lymphatic massage is that giving a slower, more moderate pressure can actually help to move the lymphatic fluid better than how we traditionally have done it, which is with very light pressure. So especially if you have some fibrosis or some hardened tissues, then you definitely want to use a more firm pressure. But overall, using a moderate pressure, still slow speed, is going to be effective for moving that fluid. So you can see here, again, we're making sure we're getting as much surface area of the skin as we can and bringing it down to the armpit. And we're pumping that down. We're pumping it down. So we're not doing one sweep. And after you've done that, again, at least 5 to 8 times, you can definitely spend more time on it. Then we're gonna be getting the outside of the arm, and you're bringing that up to the shoulder, and you can even continue moving it to that clavicle and the parasternal areas. So you're bringing it up and over. And again, slow speed, moderate pressure, at least 5 to 8 times throughout the arm. And if your arm with the lymphedema is getting heavy, again, you can have it supported. You can always use some pillows built up to rest your arm on as well. Whatever you need to be able to comfortably do this. I'll show you from the side here. So again, we're bringing that fluid up. The fluid moves where your hand moves it. So we want to make sure the direction is always moving up. After you've done the outside part of the upper arm, those 5 to 8 times, then we can start working on the elbow. So a lot of times fluid tends to pocket at the elbow, and so you want to spend some extra time here if you do have more swelling at the elbow. Again, you can have it resting on your head, you can have it straight up, whatever is most comfortable for you. But again, we're doing that at least 5 to 8 times, making sure that you're getting the entire elbow. And then you're going to do the inside part of the elbow where it bends, and we're going to do that 5 to 8 times. Nice slow pressure. You want that moderate pressure moving that fluid. And then we'll start and work on the forearm. So we're going to move that fluid down just like we did for the upper arm, and you're giving that moderate, slow pressure. I like to do this with the arm elevated and pointing up towards the ceiling. That's just going to help a little bit more with drainage. But again, make sure that it's supported so that you're not having to hold all of that arm up on your own. We're working from the wrist and moving up to the elbow. And again, at least 5 to 8 times. You can give some more pressure if you have some fibrosis through here. And after that 5 to 8 times that you've worked that forearm, bringing it up, then we're going to work on the inner part of the forearm. And so bringing that up to the elbow. And again, we're doing that 5 to 8 times. This should feel relaxing, it should feel good. If you do have some moderate or severe lymphedema, if you have fibrosis, as you do this, you should be feeling that tissue soften underneath your hand as you start to work on it. And if you are doing some other techniques with working on fibrosis, so you're doing a deeper massage or you're using tools, I do have a video on that as well you can check out, then make sure you do that first and then follow up with the lymphatic massage to help bring any excess inflammation and swelling out of that area. So after we've done that from the wrist to the elbow, that 5 to 8 times, now we're gonna go to the hand. So with the hand, you can massage just like this. So my thumb is on the palm, fingers together on the back of the hand. And same thing, we're doing that 5 to 8 times. Again, I like to have my hand pointing up towards the ceiling. Gravity is going to help with that drainage as you're doing this. If you don't have a lot of swelling in the fingers, you can also include the fingers here. And after the 5 to 8 times at the hand, if you have increased swelling at the fingers, you can do each finger individually. So we're gonna do, again, 5 to 8 at each finger. But again, if you don't have a lot of swelling at each finger or in your fingers, then you can just include them all together as you do the hand. And again, I'm just working from the front and from the back of each finger, each one 5 to 8 times. This is 3, 4, 5, 6. And then we've got the index finger. And as you do the fingers, it doesn't matter which one you start with, just make sure that you're getting all of them and you're getting all the way around them. And then don't forget about the thumb. So bringing that fluid down, again, that 5 to 8 times. And if you have swelling that pockets right in here, then you can also spend a little bit extra time right there. And so now we've gone all the way down the arm, and now we're gonna work our way back up the arm. This time, instead of doing 5 to 8 times like we did for each section on the way down, as we work our way back up to redo everything, now you're just doing it about 2 or 3 times. So we're just sweeping that fluid up from the fingers, from the thumb, from the hand. We've got the forearm, and then we've got the inside part of the forearm. We've got the elbow. We've got the outside of the arm, bringing it up. And then we've got the inside of the arm, bringing it to that armpit. We're working the shoulder as much as you can reach. And then we're finishing by bringing it over to the clavicle and over to the parasternal area. Or again, if you have more severe lymphedema, bringing it all the way across to that opposite armpit. And then finishing here on the side and bringing that up to the armpit. And then always finishing with the manual lymphatic drainage with some deep breathing. So taking your hands at your belly button, breathe in through the nose, out through the mouth, giving that pressure in. 2 more breaths, breathe in and breathe out. And 1 more, breathe in and breathe out. Excellent job. I hope that you found this updated manual lymphatic drainage sequence for the arm helpful. Again, the main changes are that if you have mild lymphedema, you don't need to move it across to the other side. Regardless of the severity of your swelling, we really don't need to move it down the trunk. And you want to make sure that you're using moderate, slow pressure throughout. Make sure that you subscribe for more videos on lymphedema management. Please like this video and share it with others who need this updated sequence.